So here I'm going to talk about the non-pharmacological therapy, particularly electroconvulsion therapy and cognitive behavioral therapy. Electroconvulsive therapy, it is an effective treatment for depression. A small amount of electrical current is delivered through the electrode attached to the template that causes a brief seizure inside the brain. Outward movement is usually a slight movement of hands, feet, or a tube because the pre-medication is given to relax the muscle. In addition, a short-acting anesthetics is given. So in this picture, you can see electric is passing through the brain, right? So electroconvulsion therapy, we use a electrical current to the brain. In this picture, we can see. And when you put the current to the brain to create a generalized cerebral seizure under the general anesthesia and increase the level of neurotransmitter like serotonin, norepinephrine, and dopamine. So if we go back, this is the usually occur 6 to 12 treatment given every 2 to 5 days, and maintaining electroconvulsive therapy once a month may help increase the relapse rate for a client with a recurrent depression. So if I tell you what are the indication of electroconvulsion therapy, particularly severe depression resist to antidepressant. So who have a very bad or very severe generalized depressive disorder, not possible be cured by treatment or antidepressant or resist to antidepressant. If the patient has a schizophrenia or mania associated with bipolar disorder, they usually go for electroconvulsion therapy. So what is beside of electroconvulsion therapy, I want to tell what is cognitive behavioral therapy. So cognitive behavioral therapy basically aimed at the modifying the patient's pattern of thinking and behavior. Usually depressed, anxiety disorder, substance abuse, eating disorder, or personality disorder are the indicated for behavioral or cognitive behavioral therapy. Our aim at addressing the changing about automatic thoughts, cognitive distortion, or underlying belief. So the goal of cognitive behavioral therapy particularly help to replace negative thought, distorted thought with positive, rational one, or may include the use of thoughts recording. In case of electroconvulsion therapy, you see, in cognitive therapy, thought create feelings of thought, feelings create behavior, and then behaviors create the thoughts. So it is a cognitive behavioral therapy, changing the thought or help to replace negative, distorted thought with a positive thought and rational one. So writing down or examination associated between the situations, thoughts, and feelings, right? So let me go back. Electroconvulsion therapy. ECT is not always effective in the client with dysthermic depression, dysthymic, or depression and personality disorder, drug dependence, or depression secondary to situational or social difficulties. So, medically, contraindication electroconvulsion therapy if patient intracranial pressure is increased. At the risk client include the client with a recent myocardial infarction, so they are contraindicated. Brain attack, it is contraindication, or intracranial mass lesion like tumor, or if the disease increases the intracranial pressure. So electroconvulsion therapy indication for use when antidepressant medication have no effect, when there is a need for rapid definitive response, such as when a client is suicidal or homicidal, when the client is in extreme agitation or stupor, when the risks of other treatment outweigh the risks of ECT, when the client has a history of poor medication response, a history of good ECT response, or both, when the client prefer ECT as a treatment. So the client with severe depressive and bipolar depressive disorder, especially when psychotic symptoms are present, client who have depression with markedly psychomotor retardations and stupor. The many clients whose conditions are resistant to lithium and antipsychotic medications, and clients who are rapid cycler, client with schizophrenia, client with schizotypic syndrome, and psychotic client. So in my class, when I will discuss schizophrenia, I will explain everything. What is schizoaffecting syndrome? What is psychotic client? So pre-procedure. So explain the procedure to the client, encourage the client to discuss the feelings, include might recording ECT, and teach the client and family what to expect. Informed consent must be obtained when voluntary clients are being treated. For involuntary client, when informed consent cannot be obtained, permission may be obtained from the next to kin. Although the some state the permission for ECT must be obtained from the court. So procedure, again, ECT stimulate is delivered through the electrode attached to the brain temple. The previous picture you saw. Medication admin during the procedure. Basically, during this procedure, we have to give some medication. So this is maintain nothing by mouth status after midnight or at least 4 hours before treatment as prescribed. Baseline vital signs are taken. The client is requested to void. Also, hairpin, contact lens, denture are removed. Admin pre-procedure medication as prescribed. If you ask me what kind of medication, definitely answer is antipsychotic like atropine, that is decrease the secretion. Anesthetics agents like methotrexate or neurotransmitter blocking agents like succinylcholine to reduce or decrease the muscle contraction to prevent injuries. What else? During the procedure, as the intervention line is inserted, electroencephalography and electroradiographic electrode are attached. The blood pressure, pulse, oxygen saturation are monitored Throughout the treatment, a blood pressure cuff is placed around one ankle and inflated to block the medication from entering the foot. When the procedure begins, seizure activity can be monitored by watching for movement in the foot. What else? So next, during procedure, medication admin may include a short-acting anesthetics and muscle relaxant. I told methotrexate or propofol, oxygen admin by fast face masks, airway is placed to prevent biting tongue, or electrical stimuli is administered before a brief seizure occurs. Post-procedure, the client is transported to a recovery room with a blood pressure cuff and ointment in place where oxygen, suction, and other emergency equipment are available. When the client is awake, talk to the client and take the vital sign. The client may be confused, provide frequent orientation like brief or simple, and also reassurance. So it is important you have to know what are the side effects of EET. So the potential side effects include confusion, disorientation, short-term memory loss. The client may be confused and disoriented on awakeness. Other side effects include headache, hypotension, muscle soreness, nausea, and tachycardia. Short-term memory loss and confusion most common. Memory deficit may occur, but memory usually recovers completely. Although some clients have memory loss lasting more than 6 months. So monitor both a depressed client as well as the client who has recently been prescribed an antidepressant medication closely for sign of suicidal ideations. If the client present with increased energy, monitor closely because it could mean that the client now has the empty to perform the suicidal act. So before to go next, I want to summarize what are the nursing care plan or what are the nursing role. So we ensure informed consent was obtained, patient nothing by mouth 6 to 8 hours prior to electroconvulsion therapy, and anticonvulsant have been discontinued prior to electroconvulsion therapy. We monitor the vital sign regularly, EEG or EKG continuously monitored. Hyperventilate patient before and after the treatment is important, and as a healthcare provider, we have to make sure patient education or teaching. What is that? Definitely patient typically requires 6 to 12 treatment, also admin 3 times a week. That is enough about electroconvulsion therapy.